Next slide. Today, so our objectives are, we'll learn about CAWEM eligibility, coverage, CAWEM Plus eligibility, and CAWEM Plus coverage is what we'll cover today. So as you all know already, CAWEM provides coverage for emergency services only, with a few exceptions. CAWEM Plus provides OHP Plus benefit packages with a few exceptions. And they are all benefit levels of OHP. Many times I have heard people say, well, I don't have OHP. Technically speaking, individuals who have CAWEM do have OHP because CAWEM is a benefit level of the Oregon Health Plan. So it's important to remember that because, you know, some people will, I don't qualify for OHP or emergency, but it is a benefit level of CAWEM, of OHP, I'm sorry. So eligibility for CAWEM is available to non-pregnant adults 19 and over who meet all requirements for OHP except immigration and citizenship status. The income limit is $138, and it is an open card. So if somebody is on CAWEM, it will be open card and only for those emergency services. So here are some of the things that CAWEM covers, or who can apply. So an LPR less than 5 years. We know there are legal permanent residents that don't meet the 5-year ban, so they are able to get CAWEM and then at the same time get a private plan through the marketplace and receive tax credits and help paying for the plan. Temporary workers, visitors for business or pleasure, exchange visitors. So, you know, if somebody's here visiting, they can go ahead and get temporary health, Oregon Health Plan. Victims of crimes, fiancés of U.S. citizens, foreign investors, COFA citizens. So COFA citizens are, COFA stands for, as you guys know, COFA, Compact of Free Association. Thank you, Colette. I apologize for that. And I just realized we didn't introduce ourselves, but you guys all know me, so I won't introduce myself. So Compact of Free Association, that is Republic of Marshallese Islands, Palau, and Micronesian Islands are all under CAWEM, and then DACA recipients. And I think here when we're talking about DACA recipients, we are talking under the bill, the executive order that President Obama signed for children who were here undocumented and can now we're able to get a Social Security worker permit and continue education in some cases. And then CAWEM Plus, the same as what I just went through, plus being pregnant.
All right, so this is Colette. I'm taking over for the next couple slides. So we have a lot of text up here on the screen, which is basically outlining what emergency medical services are as defined in rule for CAWEM. So basically they would be considered a sudden onset of medical condition manifesting itself by acute symptoms of sufficient severity, like severe pain, such that the absence of immediate medical attention could reasonably be expected to result in placing the patient's health in serious jeopardy, impairment to bodily functions, or serious distinction of any bodily organ or part. The coverage also includes labor and delivery. So even if a woman on CAWEM has not reported a pregnancy, when she would be you know, emerging at the hospital to deliver, that would still be covered. And then newly added into the coverage is female sterilization, i.e. tubal ligation, and abortion that requires a hospital stay. So you can see at the bottom of the screen that these two types of services are funded by the Reproductive Health Equity Act. So they're not federally funded services, but the way that a woman would access these services here in Oregon would be to enroll in CAWEM. And that would be, for those who are not eligible for full OHP, obviously. And then for more information about CAWEM eligible individuals who may be interested in accessing additional family planning services through the Reproductive Health Equity Act, there's a link to find clinics, or you can always call 211 to locate a reproductive health program provider. So some more kind of layman's terms around what qualifies as emergency services for the CAWEM population are described on page 11 of the OHP member handbook. But these are like sudden illnesses or injuries that need treatment right away, like appendicitis, broken bones, heart attack, stroke, concussion, etc. Dental emergencies are those like a tooth falling out, severe tooth pain, or serious infection. And then a behavioral health emergency might be to, feeling out of control or threatening to hurt yourself or others. We often get questions about how do you make sure that you're billing for services that are covered by CAWEM or CAWEM Plus. Just given that this is a shorter module training today, we're not going to go into depth around the billing side. However, we did do a longer CAWEM Plus training last August, and the information about billing in that training is still up to date. So you can always view that training, and we have the YouTube link there for you. Okay, so who is eligible for CAWEM Plus? Just as Antonio said, as far as those who are eligible, the same list of immigration statuses apply for CAWEM and CAWEM Plus. The main difference is that the woman has reported that she's pregnant, and that's how she would get CAWEM Plus. So pregnant women under 19 who are not eligible for OHP Plus solely because of immigration or citizenship status, the income limit is higher. It's 190% of the FPL. And like CAWEM, these individuals are not enrolled into a CCO. CAWEM Plus women are on fee-for-service as well.
And some of the coverage that a woman can access when having CAWEM Plus is just like any other individual who qualifies for OHP. So preventive services, vision, dental, behavioral health, labor and delivery, family planning services, prescriptions, non-emergency medical transportation, and more. So as of April 1st, 2018, CAWEM Plus coverage continues for 2 calendar months following the pregnancy end date. So for example, pregnancy ends on April 7th, 2018. CAWEM Plus continues through June 30th, 2018.
One thing that is kind of a of-the-minute update for you is around CAWEM Plus notices that are going out in April. So as of April 1st, that policy went into effect that Antonio just mentioned, that CAWEM Plus benefits now go through at minimum 60 days. So they continue for 2 calendar months following the pregnancy end date, whereas previously CAWEM Plus benefits converted to CAWEM as soon as the pregnancy ended. So that's a new policy that's been implemented this month. However, the system is still generating notices this month to women whose pregnancies have ended in April saying that their benefits are reducing to CAWEM. However, they are getting a follow-up notice that is corrected. But it is important for folks to know that this is happening. And we'll be trying to figure out a way to reach out to those clients who are affected, potentially through partners, but stay tuned on that. Some additional resources for CAWEM and CAWEM Plus. We did a whole in-depth webinar around all of the changes that have or that are taking effect as a result of the Reproductive Health Equity Act. And we did that just last month. So we recorded that webinar. Actually, it was this month on April 10th. We recorded that webinar, and you can view that. There's the link there on your screen. And then we also have CAWEM and CAWEM Plus fact sheets on group site. Okay, so short and sweet and to the point. Looks like we have some questions. And we do have, I believe, everyone on mute. So feel free to type your questions into the chat box. So the question is, will the initial visit to primary care to confirm pregnancy be covered under CAWEM Plus if they have already been approved for that coverage? Jessica, yes, that should be accurate, that visit would be covered under CAWEM Plus if they've been approved for coverage, correct. And yes, we can upload this webinar to group site. Yep. And the other two webinars that we mentioned that are recorded are already on group site under shared links. Other questions? Yes, we can go back to the slide that shows who is eligible for CAWEM. Just a moment. And I believe you're referring to the slide that shows the immigration statuses. So I'll go back to that. Cesar's asking any word on how long the one portal will be down. We don't have information about that. I know they're working on it ASAP, so hopefully soon.
You're at the wrong training, Cesar. So yeah, not just kidding. We'll get that information. Hopefully, we'll be able to post something on group site later today. Actually, never mind. Somebody just said it's back up, so now you can go ahead and use it. Cesar.
Is there an updated CAWEM two-sided fact sheet? We are working on that. We are just waiting for policy right now to review our changes, but we should be posting that as soon as possible. We know we need it updated, so that's in process.
So one of the next question we got are CAWEM eligible LPRs automatically enrolled in OHP Plus when they pass the 5 years as LPRs, or do we need to update the application information? I want to say that you have to update the application information because their status, has changed for the 5-year ban. But Connor, I will look more into that, and I will definitely get back to you with that answer if it was incorrect to what I just said.
So we're just reading the questions here. Hang tight.
I would, so the question basically is, if somebody's waiting on their, the 5-year wait period, they apply, have got benefits after, have got their LPR after 96, will they, if let's say they qualify for CAWEM at some point and then afterwards start making more money and no longer qualify for CAWEM, are their 5 years still being counted so that they may qualify for benefits in the future? Yes, because what will be looked at is the date that it was approved. That's already on the card that the individual has, the legal permanent residence card.
Other questions? Not sure if y'all are typing in your questions right now, but it doesn't look like we don't have any, it doesn't look like we have any other questions coming in. So we'll hang tight here for another minute. Okay, well, hopefully you guys know how to reach us. And if not, you can always reach out to your ROC. But I think we are all set then. Great, thank you so much. Thanks so much for the positive feedback. And I'm sure we'll see you guys next time.
All right, y'all have a good afternoon.
Have a good one. Thanks, guys. Ending the webinar now.